this next episode of Bajaj Pulse, which is an initiative of health education by Kamalnayan Bajaj Hospital. Myself, Dr. Ajay Rote. I am the Medical Director and Senior Consultant Diabetologist of Kamalnayan Bajaj Hospital. And today it is our privilege to discuss on one very important topic, that is geriatric medicine, home-based care and palliative medicine. Now, considering the increasing number of senior citizens in our society and considering their need to get special treatment, to get proper assistance and to ensure home-based care, Kamalnayan Bajaj Hospital has introduced all these services, again first of its kind in this entire region. As you know, that Kamalnayan Bajaj Hospital is one of the leading healthcare organizations in this region, which is always at the forefront of treating and providing services of excellence to the patients in this region. Let me introduce you to the dignitaries and panelists for today's Bajaj Pulse session. So it is my pleasure to introduce you with the well-known Dr. Mangala Borkar Madam. Namaskar, welcome Madam. Dr. Mangala Borkar Madam is a professor in the postgraduate department of Geriatrics of Government Medical College and Hospital Chhatrapati Sambhajinagar, and she has been instrumental to set up Maharashtra State's first geriatrics department in the Government Medical College Hospital Chhatrapati Sambhajinagar. Not only that, now we are happy that she has joined Kamalnayan Bajaj Hospital and she will be heading and running the geriatrics department as a full-time geriatric department consultant. Dr. Milind Vaishnav is a senior consultant physician. He is also director of academics, research and transplant of Kamalnayan Bajaj Hospital. And Dr. Mahesh Patil, who is specialist in geriatric medicine, who has been practicing as a full-time geriatrician of Kamalnayan Bajaj Hospital. So this is an entire team which is focusing on geriatric care services. Now let us understand what is this special need and what are the facilities which are offered by Kamalnayan Bajaj Hospital. Now ma'am, coming to you first, often people think that medical care, health care given to the elderly population is just as same as given to any other patients of similar age or any other age. So how do we differentiate between these and what is the importance of this differentiation?
The geriatrics age group in our country is 60 years and more and above.
Yeah.
And we have about 15 crore geriatric persons in our country as of now.
Yes.
And this number is likely to double in the next 20 years.
Yes.
Many of these persons, say up to the age of 70, 75, they are quite active, they are quite healthy. But some of them may be sick, and as they grow older, their problems increase. As you know, aging produces a decline in the functional capacity as well as the structure of various organs. And the reserve of the body becomes less, the immunity becomes less. And due to that, many illnesses which are not there in the younger age develop at older age. Or those which were there, say diabetes, hypertension, maybe they're at the younger age also. But more persons in the older age are likely to have it. Also diseases like cancer, then joint and mobility problems, memory problems, strokes, paralysis, heart diseases, lung diseases, kidney. The reserve becomes less, and many medicines, polypharmacy. A lot of medicines they have to receive because of their multiple illnesses. Some may be judicious, some may not be. So they are overloaded with medicines also. So all these things we have to see, and they have some specific problems which are only there in the old age, including depression. And nowadays we see a lot of mistreatment also. The attitude of the society and problems which they have in their family as well as an ageism due to their age. So that discrimination which is there. So for all these reasons, the government and the National Medical Council, earlier the Medical Council of India, they introduced geriatrics medicine as a postgraduate separate subject, because just like pediatrics needs special attention, pediatrics age group, similarly they feel that geriatrics age group has special problems and the person should be able to focus on them without triaging or without discrimination.
Yes.
That's why this subject has come up, sir.
Very nice. So
Sir.
you must have understood that the importance of elderly people and taking special care of them. Their needs are different, so service provision has to be different, and it has to be as per the requirement.
Right.
Coming to Dr. Milind, now you have been a senior consultant physician, practicing physician, and you see patients across all age groups. Now, when you see a patient who falls in the geriatric category, as madam has mentioned, so a patient above age of 60 years, what adoptions you make in your approach to such patients?
Yes, over last 25 years, I have learned one important lesson when treating with patients who are 60 years or above, that they have some different needs as far as their diseases are concerned. In other words, when I deal with senior citizen patients, I have to keep many things in mind. Number one of them is they have some limited body abilities, right from hearing, vision, or even understanding of the things which I am saying. So I have to keep this in mind. Number two, they come with their disease and something more. That something more is their apprehension about the disease, apprehension about death, apprehension about loss of abilities. So all these things I have to keep in mind while dealing with such patients. Number three is these patients, many times they get confused when we advise them medicines. So I have to be very patient while talking to them about their medicines, about the things which I advise them, about the diet advices. In this context, I have noticed whatever instructions I give them, many patients they convey their inability to follow these instructions because of lack of home support. So these and there are certain other things which make me think that these geriatric patients, they need special approach as far as treatment of their common diseases is concerned.
Very good. So very nice. So practical, it's a practical input. Like
Absolutely.
any physician, when he or she comes across a patient who is of geriatric age group, they should have some adaptability
Yes.
as per the requirements. It's very essential.
Yes.
Now coming to Dr. Mahesh, so as a part of these geriatric services, Kamalnayan Bajaj Hospital has also started the home-based care, and this is one of the first hospitals to start to understand the need of a home-based care, because it is often felt that healing occurs better at home, in the homely surroundings. So how can you just tell us about what is this special home care services which have been started by Kamalnayan Bajaj Hospital?
Yes, sir.
Yeah.
As you said, the healing occurs more at home.
Yeah.
So, Kamalnayan Bajaj Hospital introduced the Care at Home program.
Yeah.
This program is very useful for those patients having chronic comorbidities like diabetes, hypertension, or chronic illnesses like stroke, then dementia, Parkinson's disease. For these patients, this Care at Home program is very useful.
Yes.
In Care at Home program, we provide the geriatric consultation, then nursing care services, then physiotherapy services, then dietitian services, and some physiotherapy services for them.
So home-based care is a comprehensive service package offered by Kamalnayan Bajaj Hospital, which includes provision of nursing services, attendant services, diagnostic services, remote monitoring services, and if required, doctor visit also. So it's a comprehensive package. So our vision before starting this home-based care services is, except for those patients who require ICU treatment, all others should be available at home. That is our long-term vision in this subject. Now coming back to ma'am, ma'am, you have already enumerated the specific diseases which are particular to geriatric population. So would also request you to just repeat that what are the diseases which can be included as a special diseases in geriatric population. At the same time, would also like you to enlighten us about what is this palliative care and how important it is.
As far as the diseases are concerned, with aging,
Yeah.
all the cells of the body, organs of the body age. They may age to a variable degree in the same person. They may age to a variable degree in different persons.
Yeah.
But they age slowly. and the function declines.
Yeah.
So every organ, the function declines, and the illnesses which are there at a younger age, the degree of the severity as well as the numbers,
Yes.
both increase as you grow older.
Yeah.
So like we mentioned hypertension, diabetes, and even cancers, and such things increase as you grow older. Apart from that, there are certain special problems which occur in old age. As Dr. Milind mentioned, hearing problem, vision problem, which give rise to number of problems. Then mobility problems may be there, imbalance may be there,
Yeah.
memory loss may be there, and the persons may have more frequency of strokes,
Yeah.
paralysis, and Parkinsonism,
Yeah.
dementia.
Dementia.
So all these things increase as you grow, the numbers increase as you grow older.
Yeah.
Apart from that, urinary incontinence, not having control on the urine, or constipation, not getting good sleep, feeling depressed, and then proneness to various infections because the immunity is low. So all these things increase as you grow older.
Yeah.
Apart from that, nowadays elder abuse or mistreatment,
Yeah.
the numbers of that is also increasing. So it may be just like verbal insults or neglect, or there may be physical injuries which are inflicted on the older person. Financial abuse is very common. All these things lead to decrease or decline in the quality of life of the older persons. And we as a team have to see that the quality of life of the older persons increases, even if we cannot increase the quantity.
Correct.
So quality has to increase.
Yes. And palliative care.
Yes. Some diseases can be cured,
Yeah.
like infectious diseases. Some can be prevented. Some can be controlled, like diabetes, hypertension. The person can have a normal life. Even cancers. Many cancers can be cured nowadays if they are detected early. But some cancers may have spread. Then the person grows old and he may develop dementia, and he may become bedridden. Like Mahesh mentioned, bedridden states may be there due to paralysis and dementia and other problems. Then also the person may be totally dependent because he is too old for his day-to-day activities. And these are the problems where we should come in and help to improve the quality of life of the person as well as the family. So what we can do for the family also. So it is a holistic approach, sir, palliative care. And in that we have to look at the physical, the mental, the emotional, the social, financial. Of course, we can help sometimes through some schemes or through our hospital by charity and other things. But these aspects as well as spiritual. So a holistic approach to a person who cannot be cured. And most important, we have to start it early in the course of the illness. Don't wait for the treatment to totally stop or fail and then you start palliative. Palliative has to start with the treatment. Whenever you feel that the disease is incurable, it may be dementia, it may be Parkinsonism. Parkinsonism is treatable that way to some extent, but maybe a cancer which has spread, or a person who is having COPD which is very severe. So along with the treatment you start palliative and try to improve the quality of life of the patient. So the pain, the comfort, the mental anguish which the person and the family is suffering, all this has to be addressed in palliative care.
Wonderful. So in very simple words, Madam has expressed her views on palliative care. Now, as she has rightly pointed out, it's a holistic approach. Now, yesterday I was reading one article. So today's medicine unfortunately has become organ specific. It should start considering patient as an organism, not as an organ. That was it was
very right.
So very nice, ma'am. Thank you, Dr. Milind. Like you mentioned, like adaptability while seeing the patients. Now, as Madam has also mentioned, there may be certain diseases which are preventable in geriatrics. So, what is your thought about this preventive aspect of geriatric diseases?
Yes, preventive medicine is very important at all age groups, more so in geriatric population. Because prevention of the diseases, if not done properly in geriatric population, can lead to disastrous consequences. A simple example is prevention of falls. The precautions are very easy to follow as far as prevention of falls is concerned. But if these precautions are not followed, and if an elderly fellow, he has a fall and fractures his limbs, then death is very imminent. So prevention carries a great importance in geriatric population. Now, prevention works at various levels, that is primary prevention, secondary prevention and tertiary prevention. Primary prevention is like we should avoid the disease or the event to happen. For example, we educate the geriatric population how to prevent falls or how not to injure themselves, how to avoid polypharmacy, how to avoid making mistakes in taking medicines.
Yes.
So this is like primary prevention. Secondary prevention in geriatric population, if something has happened, how to deal with it, how to prevent future complications arising out of this event. So this secondary prevention we can teach them. For example, again I take the example of falls. Even if a person has a fall and he fractured himself, now offering him the best possible help and offering him the best medical treatment so that the complications of that fall, they are prevented. And tertiary prevention is like preventing the deadly outcome out of all these events. So this prevention in geriatric population has a great role to play.
Yeah. Two more aspects as you mentioned. One is vaccination.
Yes,
And
another one is vaccinations in these elderly people.
Yeah.
So now we have effective vaccinations for adults also, prevention of pneumonias, prevention of what we call as shingles,
Yes.
that is herpes zoster. So all these illnesses, they are very, you can say, painful or uncomfortable for the elderly people. And pneumonia, we all know, it can be the last disease in the patient's life.
Yes.
So prevention of this pneumonia, shingles, influenza, so all these vaccines are very well available. They are time-tested vaccines. So all the geriatric population should be vaccinated against these preventable illnesses.
Correct. And the last thing is about, like, many of these people are lonely. So to take care of their loneliness, proper counseling, and as Madam mentioned, the spiritual health of all these patients, that can prevent the mental decline.
Right.
Now, in this context, I would like to tell one of the great minds in medicine, Milind Vaishnav. He has said that as a physician, you should always remember that he can cure rarely, he treats often, but we can comfort always. So this is applicable to a great extent in geriatric population. So geriatric population needs your comfort more than your treatment.
Correct.
Absolutely.
So this comfort level, if you maintain with the geriatric population, much of the preventive work is done.
Correct. And iatrogenic, like medicine-induced problems, like we have seen one of the patients who was receiving around 40 medications.
Yes.
And when we saw that at least 20 of them could be removed. So that drug-drug interaction causing problems to the patient, that we have to just sit and go through all the list of medications.
So one of the fundamental duties of a geriatric physician is like what we call as medicine reconciliation.
Yeah.
Because the patient, because he has multiple illnesses, he is seen by various specialists. Every specialist gives one prescription,
Yes.
and patient ends up taking 10 prescriptions or 5 prescriptions. And many times there is a duplication of medications. Many times there are medicines which interact with each other. So what geriatricians do is they reconcile all these medicines, remove what is duplicated, caution the patient about all these medicines, and we have been able to successfully reduce the prescription from say 20s to hardly 2 or 3 medicines.
Yes.
May I add something?
Yes.
And it's apart from the prescriptions, it is very useful to actually see what they are taking.
Yes.
So always ask them or the relatives to bring what medicines
What
they are
medicines
taking.
they are taking?
Because the prescription may have something and they may not be
They may be
taking.
taking something else.
So what are they taking currently?
Yes.
That is very important.
So this is another preventive aspect.
Yes.
Very well.
Yes.
Dr. Mahesh, you have been doing this home-based care by Kamalnayan Bajaj Hospital. Now you must have received many feedbacks and experience sharing by the patients and their caregivers. So what are the benefits, if you can enumerate few of the benefits which the patients and their caregivers perceive as a part of the home-based care started by Bajaj Hospital?
The care at home program, which is a very useful program, as earlier mentioned, for these patients. So when we care elderly patient at home, it is not only useful only for caregiver, it is useful for patient, their caregivers and doctor also.
Right.
For doctor, it is an doctor get the opportunity to see the whole things at home. So like environmental factors to see. So we can modify these environmental factors. Those are having risk. Means if the patient is taking care at home, so it is very calming for the
Patient and
relatives.
attendants.
So means care at home, it will reduce the time for consultation, then it is cost effective, then care at home also reduces the anxiety for hospitalization. So these issues address
They are very important and they are found to be beneficial for the patient as well as the relatives. Very good. Now, quickly, each of us, I would like to enumerate which components of these services have been started, or what is the vision of expanding these services by Kamalnayan Bajaj Hospital. I will start from you, like the geriatric services and the palliative care services.
Yes.
Yeah.
Home-based care is already in place, and you plan to start a certificate course for the same.
Yes.
And you plan to start a geriatrics department
Exactly.
also in future.
Yeah, you will be leading it, ma'am, under your guidance itself.
But we definitely started.
Yes.
Right. And then this holistic care,
Yes.
palliative care.
Yes. Yes.
What do you want to add, Mahesh?
in future we can start a clinic, specialized clinics
Specialized clinic.
for dementia patients, like
Yes.
dementia clinic, urinary incontinence clinic, as we have started the safe step clinic
Yeah, that I was
for
going to
prevention.
For prevention, we have started the Safe
Right.
Steps Clinic.
So as time progresses, we can make a integrated geriatric care model, which should include the home-based care, OPD, IPD consultation, and physiotherapy and all specialties.
In fact, we can start a geriatric support group program also, like
Yes.
we have for other diseases
Yes.
also. There will be a people, geriatric patients who come as a group and we discuss with them.
That will be very nice.
That is
Please
another
do
thing.
that.
That
And
will be-
telemedicine services you were mentioning.
Yes, we are starting the telemedicine services
So
also.
that will be very useful for
Yes,
people
yes.
who are like
Yeah.
bedbound or
Yes.
Even
they're homebound.
they can actually see and talk with
Yes,
their
yes.
consultant, even
That
if
is
they
very
are bedbound.
That is very useful.
Dr. Milind, I would like to ask you about, you discussed very nicely about the strategies for preventing geriatric disorders. So what are the facilities which are provided by Kamalnayan Bajaj Hospital as far as this preventive aspect is concerned?
Yes, Kamalnayan Bajaj Hospital has pioneered this geriatric care in private sector in this region. So, as far as preventive aspects of geriatric care are concerned, we have come up with various strategies. As just mentioned and discussed, we are coming up with various clinics like fall clinic, safe step clinic, and dementia clinics. In addition to that, we have these vaccination centers with us,
Yes.
adult vaccinations we have with us. Then we will be forming some support groups as far as geriatric care is concerned. In these, the patients themselves and the caregiver support group is also there.
That is very
In addition to that, we will be doing caregivers training centers also. So, caregiver is a very important connect between the geriatrician and the patient. And caregivers fatigue or caregivers burnout is a very important aspect in this whole chain. So, to address this issue, caregivers motivation, caregivers training, these clinics also will be starting. We'll be starting some caregivers certificate courses also for that. So these are a few of the initiatives which we are taking.
Soon will be specialized as a part of specialized nursing care program.
Yes.
There will be specialized geriatric care nurses.
Geriatric care nurses
There
will be trained at
home-based
our
care,
institution.
care nurses also that will be starting. So, as you must have gathered that the services of geriatrics, home-based care and palliative care have been introduced by Kamalnayan Bajaj Hospital with the sole intention to provide the much needed facilities beyond the hospital walls. So, all the senior citizens and their caregivers, please count on us for any of these services and any of the requirements. So, thank you very much and all the best. Dhanyavad. Thank you.